Autonomic supply of the pelvis. First of all, we can divide autonomic supply to the pelvis to sympathetic supply, parasympathetic supply, and autonomic nerve plexuses in the pelvis. First of all, sympathetic supply of the pelvis. The sympathetic fibers enter the pelvis through three routes. The first route and the commonest route is this plexus in the previous video, which is hypogastric plexus. This is the most important plexuses. Superior and inferior hypogastric plexuses are the most important route which supplies the pelvic organs. And also sympathetic fibers enter the pelvis by periarterial plexuses, which are vasomotor to the internal iliac artery and its branches. The third route is the sacral sympathetic part of the sympathetic chain. The sacral part of the sympathetic chain, which actually provide sympathetic supply mainly to the lower limb. The pelvic part of the sympathetic chain enter the pelvis as continuation to the lumbar part of sympathetic chain by passing in front of this part of sacrum. This part of sacrum is called ala of the sacrum. The sympathetic chain passes in front of the ala of the sacrum and behind the common iliac arteries to become the sacral part of the sympathetic chain. The sacral part of the sympathetic chain passes in front of the sacrum, just medial to these foramina. What are these foramina? These are called sacral foramina. The sympathetic chain passes medial to the sacral foramina in front of the sacrum. And in the middle line here, passes artery called median sacral artery. And the sympathetic chain passes just lateral to the median sacral artery. The two sympathetic chains fuse at their lower ends to form a single ganglion called ganglion impar. The sacral part of the sympathetic chain containing 4 sacral ganglia. What are the branches of this part of the sympathetic chain, which is the sacral part of the sympathetic chain? First of all, and simply, the sacral part of the sympathetic chain gives lateral branches, which are gray rami communicants to the sacral and the coccygeal spinal nerves. And actually, what is the story of this gray rami communicants? Actually, the preganglionic fibers, the cell body of the preganglionic fibers originate in the lower part of the thoracic region and the first lumbar segments of the spinal cord, as usual from the lateral column. From the lateral column of the lower part of the thoracic region and first lumbar segment of the spinal cord presents the cell body of the preganglionic neuron. And as usually, the preganglionic fibers enter the sympathetic chain. Enter the sympathetic chain and pass in the sympathetic chain. The preganglionic fibers pass in the sympathetic chain without relay to reach the sacral part of the sympathetic chain, where the preganglionic fibers end and the postganglionic fibers start. and the postganglionic fibers pass to the gray rami communicants to connect with all spinal and coccygeal nerves. And actually these postganglionic fibers distribute with the sacral nerve, which here form the sacral plexus. These fibers pass with the sacral plexus to mainly the lower limb and the perineum. These are the lateral branches, which actually the postganglionic fibers. Medial branches. Medial branches from sacral part of sympathetic chain pass medially. Pass medially from the first to sacral ganglia. From the first to sacral sympathetic ganglia to the hypogastric plexuses. Actually to the inferior hypogastric plexus. And other fibers pass medially from the sacral part of sympathetic chain to pass around this vessel, which pass in the middle line in front of the sacrum, which is called the median sacral vessels. This is the median sacral. Therefore, lateral branches to actually gray rami communicants to the sacral nerves to the lower limb, and the medial branches from S1 and S2 to the inferior hypogastric plexus, and other branches to form plexuses around the median sacral vessels. This is the sympathetic supply of the pelvis. What is the parasympathetic supply of the pelvis? The parasympathetic supply of the pelvis is derived from the sacral parasympathetic outflow. The cell bodies of this flow, as we know from previous videos, present in the lateral column of S1, S2, 3, and 4 spinal cord segments. The cell bodies of the preganglionic neurons present in the lateral column of S2, 3, and 4 spinal cord segments. And the preganglionic fibers, as we know from the previous videos, pass in the anterior root of spinal nerve to the nerve trunk to the anterior primary rami of S2, 3, and 4. From the anterior primary rami, fibers pass from the spinal nerves to form nerves called pelvic splanchnic nerves. These are the pelvic splanchnic nerves. The pelvic splanchnic nerves play an important role in erection. Therefore, also they called nervi irrigens from erection. Nervi irrigens. And the pelvic splanchnic nerves containing the preganglionic parasympathetic fibers enter in the formation of the autonomic plexuses in the pelvis. Actually, the fibers in the pelvic splanchnic nerves supply what? They send ascending fibers. Send ascending fibers in the hypogastric plexuses to the aortic plexus, to inferior mesenteric plexus. And these fibers actually supply the hindgut and the ureter. These are ascending fibers. Plus, the pelvic splanchnic nerves enter in the formation of hypogastric plexuses. Hypogastric plexuses which supply the pelvic organs and the genital organs. Pelvic organ and genital organs. These nerves to the pelvic organ play an important role in our life. Regulate urination and defecation. Regulate emptying of the urinary bladder. Contract the urinary bladder and relax the sphincter. Contraction of rectum and relaxation of internal anal sphincter to pass feces. Control sexual function. The most important is regulate erection. Therefore, pelvic splanchnic nerves are very important in excretion of urine, feces, and semen sexual intercourse. What are the autonomic nerve plexuses present in the pelvis? The autonomic nerve plexuses present in the pelvis, we know one of them from the previous video, which is superior hypogastric plexus. There is a beautiful table for the superior and the inferior hypogastric plexuses. First of all, the superior hypogastric plexus. How it is formed? It is formed by branches from the aortic plexus. The superior hypogastric plexus is formed by branches from the aortic plexus containing sympathetic fiber. This superior hypogastric plexus containing sympathetic fibers, which are actually descending fibers from the lumbar splanchnic nerves. Here we can stop for a second. You should notice that always the sympathetic fibers descend from above to supply the area or region below the origin of the sympathetic fibers. Like what? Thoracic splanchnic nerves, greater, lesser, least splanchnic, originally comes from the thoracic part of the sympathetic chain and descend to supply the foregut and the midgut and the kidney. And lumbar sympathetic chain. Lumbar sympathetic chain, the fibers descend to supply the pelvic organs through the hypogastric plexuses. And the sacral sympathetic chain, their fibers descend to supply sympathetic supply to the lower limb. Therefore, notice that from the sympathetic ganglia, the fibers in the abdomen and the pelvis descend from above to supply a region or area below. Sure, the parasympathetic supply for this plexus is ascending fibers from below. Parasympathetic supply from the pelvic parasympathetic outflow, which is pelvic splanchnic nerves. Therefore, branches from aortic plexus, and this plexus containing descending fibers sympathetic from lumbar splanchnic and ascending fibers from parasympathetic from pelvic splanchnic nerves. Where is anatomical position of this superior hypogastric plexus? The superior hypogastric plexus present in front and just below the bifurcation of the aorta, in front of the fifth lumbar vertebra, and in front of this projection in the sacrum, which is called the promontory of the sacrum. This is another view. The superior hypogastric plexus present in front of the bifurcation of the aorta and just below the bifurcation of the aorta, in front of the fifth lumbar and the promontory. This is the superior hypogastric plexus. Distribution of this superior hypogastric plexus branches to inferior hypogastric plexus. These are descending branches, and also the superior hypogastric plexus gives ascending fibers upward to the inferior mesenteric plexus, and these ascending fibers containing parasympathetic fibers from pelvic splanchnic nerve to the inferior mesenteric plexus to supply the hind gut. Finally, the superior hypogastric plexus divide into right and left branches. These right and left branches are called hypogastric. Right and left hypogastric nerves, which descend downward to share in the formation of inferior hypogastric, or also called the pelvic plexus. Superior hypogastric plexus containing ascending parasympathetic fibers to inferior mesenteric plexus, and containing descending fibers from lumbar splanchnic nerve sympathetic. The superior hypogastric plexus gives ascending branches to inferior mesenteric plexus and descend downward by divide into right and left hypogastric nerves, which enter in the formation of inferior hypogastric pelvic plexus. The most important plexus and the direct supply to the pelvic organ is the inferior hypogastric plexus, or also called pelvic plexus. The pelvic plexuses or inferior hypogastric plexuses containing sympathetic fibers. From where? From above. From above, from where? From the lumbar splanchnic nerves. Lumbar splanchnic. And from first and second sacral segment of the sympathetic chain. Sympathetic supply comes from above through the right and left hypogastric nerves. Right and left hypogastric nerves, which actually descending fibers from lumbar splanchnic nerves, sympathetic, plus additional fibers from S1 and 2 sympathetic ganglia. Parasympathetic supply to this plexus sure from the pelvic splanchnic nerves. This inferior hypogastric or pelvic plexus present where? Present on the lateral aspect of rectum, this is the rectum, and the lateral aspect of the urinary bladder. Branches and distribution of inferior hypogastric plexus. Inferior hypogastric plexus is the main autonomic supply of the pelvic organ. It gives rectal and vesical plexus. Rectal to the rectum, vesical to the urinary bladder. Vesical means urinary bladder. And in female, it gives prostatic plexus. This is the prostate. Just below the urinary bladder. This is the urinary bladder and this is the prostate. Gives the prostatic plexus in male. Prostate present only in male. And in female between the rectum and the urinary bladder, there is the female genital system. And it gives autonomic supply to uterus and vagina. Therefore, in female, instead of prostatic plexus, there is uterovaginal plexus to the uterus and the upper part of the vagina. These are the autonomic nerve plexuses in the pelvis. And finally, I remember one point, the lumbar splanchnic nerves. What is the number of lumbar splanchnic nerves? Lumbar splanchnic nerves may be from 2 to 4 nerves. And if 2 nerves, the 2 nerves arises from the first and second lumbar sympathetic ganglia. But if 4 nerves, each lumbar sympathetic ganglia gives one of the 4 lumbar splanchnic nerves. This is the autonomic supply of the pelvis. Thank you for good listening and good luck.